Hi everybody, Dr. Demetrios Kydonieus here, chiropractic nutritionist in Ruckersville, Virginia. I see patients 3 days a week in this office from like 10 to 7, and then I do online telenutrition visits for nutritional patients all around the country and one or two in Europe. So exciting stuff going on. So today we're going to talk about osteoporosis. Osteoporosis is a significant loss of bone density. That means you have lost about 1/3 of your bone mass, which is not a good thing. That makes the bones a little brittle and not as strong, okay? Osteoporosis starts in women usually sooner than men. Literally after childbirth years in the 30s, we start losing bone mass, especially ladies. Guys, very small percent, but ladies will lose a bigger percent. By the time 50s roll around and women are in perimenopause, beginning right before menopause, hormones are shifting, estrogen, progesterone, and that accelerates the bone loss. So women need to be paying attention to their bone strength a little sooner than guys. Guys usually will start to experience a significant amount of bone loss in their mid-60s, to definitely by the time they're 70. So if our bones are a little brittle, we're worried about literally spontaneous fractures. We're standing there and all of a sudden we kind of turn fast and our hip snaps right in half. Our leg bone literally breaks right through the center. Pretty scary thing. Of course, when that happens, we fall down. We tend to then break our pelvis or fracture our pelvic girdle. These bigger bones down here that you see on my model back that way. So osteoporosis, serious thing. The word osteopenia basically is pre-osteoporosis. So you're losing bone, but you're not in that 1/3 loss of bone mass. So osteopenia means you need to start paying attention if you get diagnosed with that. How do you get diagnosed with it? You can see it on x-ray, but by the time you can actually see it on a traditional x-ray, you're in pretty bad shape. You're osteoporotic. You've lost a significant amount of your bones before to see it on x-ray. So over 50, ladies should be getting a bone scan or a DEXA scan or a bone density scan, not a bone scan, different test. A bone density scan. Yes, there's some positives and negatives to DEXA scans, their accuracy and all that kind of stuff. But in general, they're a good test and they work. They give you a number and they give you a starting point so that if you do get diagnosed with loss of bone density, osteopenia or osteoporosis, you can start doing something proactively, because it is going to take proactive things. You're going to have to change your lifestyle, okay? You're probably not eating enough dark leafy green vegetables. You're not getting enough nuts and seeds and certain fruits that are high in different minerals and all those kind of things. You're eating probably too many carbs and too much sugar. That's going to accelerate bone loss or bone density degradation, okay? As generally we get older, we all suffer from lack of activity. So even if you were an exerciser in the first half of your life, generally things seem to change socially and physiologically, where we get distracted and we just don't exercise like we used to, and we take a break. I know I'm 63 now, just turned 63 a week ago, and I've taken a break for the last 7 years. I exercised like a fiend until I was 55, and then at 55 I kind of shifted into business gear and put a lot more focus on my practice, and have been helping about 4 times as many people, but there's only so many hours in a day, so my exercise schedule is down and it's not what it used to be. So just like you, I need to work on it as well. So lifestyle is going to change. We don't eat as well. Now luckily I eat really well and I do a lot of veggies, and I also take supplements. Supplements are needed to some extent. Some of you are taking more supplements than you need, or you're not taking the right combination of supplements. This video is not going to go into supplements. Supplements, honestly, many of you will need to see a nutritionist to actually get some personal one-on-one coaching based on your needs. There's a whole lot of really cool modern tests we can do now to test your nutrition. There's traditional muscle testers. Muscle testing is a neurological, physiological reflex that certain practitioners like myself and others learn how to do to interpret what's happening in your body, because your body is different than your sister's body, than your brother's body, than your parents' body, and what you need is going to be slightly different. Most of us are familiar with the term functional medicine. Functional medicine, although it's not medicine anymore, functional medicine is using medical lab tests like blood work, urine tests, organic acids, hair analysis, certain breath analysis, all these type of things, to where we will then figure out what system is not working really well and needs a little pick-me-up, and we will try to pick that system up using natural means. In other words, herbs, vitamins, lifestyle changes, exercise. Okay? That's what functional medicine. So a chiropractor can be a functional medicine doctor. A medical doctor, if they take naturopathic courses, can be a functional medicine doctor. A naturopath, a homeopath who uses lab work can be a functional medicine doctor. An acupuncturist can be a functional medicine doctor. So don't think it's only medical doctors doing medical tests. It's using medical tests and then applying natural lifestyle changes to improve those tests without using prescription medicines or drugs. Okay? The last part of osteoporosis is exercise. Yes, we all need to exercise for lots of reasons, not just osteoporosis, but we need to keep up with it. So if you're not keeping up with your exercise, or like I've just said, I've kind of fallen off the exercise wagon and don't hit it as hard, you have to at some point work it back into your lifestyle. Otherwise, your body will break down faster than you would like, and your bones may break, your heart may get clogged, you'll gain more weight than you need, your brain will not work as well with low exercise and low activity. Now, what kind of exercise specifically is good for osteoporosis? Okay, osteoporosis needs what's called weight-bearing resistance exercise. That basically means weights or stretchy rubber bands. So you got to have something pulling on the muscle and putting pressure on the bone, unlike swimming, to trigger the bone to absorb more calcium and become stronger or denser as far as its mineral matrix is concerned. So swimming is a great exercise cardiovascularly. You can build some good muscle tone and strength, okay? But you will not build bone density with swimming, because when you swim, you're floating in the water. There's no gravity pushing on your bones because the water is suspending you. You need to be here on the ground, and you either need to be kind of on a platform. I'll talk about vibration platforms in a moment. You need to be jogging. You need to be weightlifting, pushing weights where the weights are squeezing you against the ground, triggering your bones to hold on to their calcium and absorb more calcium from the diet and or the supplements that you take. So when we're on exercise, we're going to touch on the controversy on vibration platform. And vibration platforms basically work by making your muscles contract in between the actual exercise that you're doing, or just standing on them. It's shaking you, kind of like jumping on a mini trampoline does the same thing. Vibration platforms, you can just do more than you can do on a trampoline. Newer research is kind of saying that maybe vibration platforms don't seem to be causing bones to hold on to their calcium any better than doing exercise on the flat ground. That may be. There's still a lot of older studies that initially said they do cause bones, not only muscles, to hold on to things and get stronger faster. So with that, as research goes, it just means we need more research. So at this point, they're good for you in a health-wise. They will trigger more muscle contractions, which will help your muscles get stronger a little faster. And when we're older, we're losing muscle quicker. If we're exercising, it takes longer to make strength gains, to build muscle than it did when we were younger. And all those things, to me, say that vibration platforms are a good thing. General rule of thumb, if you've had joint replacements, you don't use a vibration platform for about 90 days. If you wanted to be ultra safe, you could say, 5 or 6 months before you get on a vibration platform. The vibration platform is not going to shake the metal end of the knee replacement out of the leg bone. But if you did it too soon, it could cause some arthritis to happen in there, where that metal is banging against the bone and the bone is not fully bonded and filled in all the little nooks and crannies of that metal joint replacement or shoulder replacement, if we're talking about that, or hip replacements. So no vibration platforms for joint replacement people until about 6 months, just to be totally safe. Unless your doctor says you can do it sooner, then you got heads up and go for it. So to kind of sum this up, osteoporosis, significant loss of bone loss. We're worried about that. Why? Because if a hip fracture especially occurs in a person over the age of 60, the current research says that 1 out of 5 people will actually lose their mobility for the rest of their life. They will be using a cane, a walker, a wheelchair for the rest of their life. And none of us want to be in that position if we can avoid it. 1 out of 3 of the people that do become disabled, so to speak, from a osteoporotic bone fracture will actually pass away within 5 years of that fracture due to comorbidities. Comorbidity means other diseases, heart disease, kidney disease, brain disease, liver disease, some autoimmune, thyroid, metabolic kind of condition will kind of overwhelm you, let alone diseases like cancers, will overwhelm you because of your lack of mobility. So fractures, bad, but fractures when you're old are real bad. Okay, so we want to maintain good bone health. Last thing is, there are drugs out there. Fosamax is the most common. There are IV medications that work. Unfortunately, they have really bad side effects because they mess up your intestines. They cause nausea and upset tummy. And they take about 2 years to work. The best shot you have with exercise, supplements, eating a balanced diet, and taking a drug is about 8 to 10% increase in bone mass, which is pretty significant. But there's some newer therapies out there, pulsed electromagnetic wave or frequency therapy, which is a big magnetic field. And there's mats out there you could lay on, things like the Beamer, good mats. They're expensive, 5-6 grand. There's some better mats now that are less expensive in the $1,500 to $3,000 range that create a magnetic field, and you just lay on it or you sleep on it, for goodness sakes. You put it under your mattress and it comes up through the bed, and it basically stimulates your bones to hold on to calcium and to be stronger, if you will, to keep it really quick and simple. There's a lot of videos out there on PEMF, or pulsed electromagnetic field therapy for osteoporosis. We'll be getting a unit that'll be in this very room pretty soon that'll have these giant rings. It'll be super strong, around 1,000 Tesla, which is much stronger than any of the mats or the Beamer that's out there, and it'll focus that electromagnetic force on your nervous system. It'll help your nerves and your brain work better, and it'll actually stimulate bones about 3 times better than the best drug, and there's no side effects. Really cool stuff. So it is safe to get adjusted, by the way, if you have osteoporosis. You just need a chiropractor to know you have osteoporosis. So if they're a hand adjuster, they're doing a light hand technique. If they are an instrument adjuster, they use a little rubber tip tapper, and they're tapping the bones back in place with speed. Those techniques are fine for osteoporosis. I personally adjusted hundreds of women over the age of 80 with bones of tissue paper and never had a negative incident ever happen. So chiropractic can be done safely with anyone suffering from osteoporosis. So check out more information on the website. This is Dr. Demetrios Kydonieus, chiropractic nutritionist, signing off, and you have a great day.